the first group. How many of you have any family member or a friend who has have any of you witnessed a seizure? What kind of seizure did you witness? Oh, you had a seizure. Okay. Explain to us. Can you speak up, please? Can we hear us? Yeah.
I got the seizure.
Well, seizures are actually quite common. What is a seizure? Normally the brain cells, the seizures originate from the cerebral cortex. Okay? They do not. And they originate from the gray matter of the cortex, not from the white matter. They do not originate from the brain stem. They do not originate from the cerebellum. They originate from the gray matter of the cerebral hemispheres, one of the two. Okay? Normally, as a rule, brain cells communicate with each other in an orderly fashion. If there is a seizure focus in a particular area of the brain, then all of a sudden, a group of cells, a large number of cells, misbehave and they discharge their electrical signals in a very disorderly fashion. It's like a sudden storm in the brain, a sudden storm of electrical signals in a very haphazard fashion. And that results in a seizure which we can witness. Most of the time, when a seizure occurs, there is a loss of consciousness, but it's not a must. Just many different kinds of seizures where there is actually no loss of consciousness, and we will come to that. Frequently, there is a stereotype motor activity, and let me explain. For example, you read about the general anatomy, neuroanatomy of the brain, and that there is an area that controls the motor function, right? My left half of the brain controls the right side. It's called the precentral gyrus, correct? Do you remember that? Yeah. Okay. And there is a face area, there is a homunculus, and if there is a seizure focus in the face area, my other side of the face will start jerking like this. That's a seizure. That's a motor activity. It's a focal motor seizure. Okay? Or the patient may experience some kind of sensory phenomenon, such as tingling, numbness, or all of a sudden, or smell, or taste in my mouth, or I may see flashing lights, or I may see an animal, or this young lady becomes as if she's so tall that she's touching the ceiling. Okay? All these are various kinds of sensory experiences that we can feel during the seizure. Okay? And one seizure does not constitute epilepsy. Okay? Epilepsy is a chronic condition where an individual has experienced at least 2 unprovoked seizures. What do I mean unprovoked? Unprovoked seizures, yes.
Like without alcohol or
Right. Okay? Or if you snorted cocaine, if you ingested a good amount of amphetamines, you can have seizures. Those are not epilepsy. Okay? Any question? The difference between a seizure and epilepsy? Epilepsy is an established condition where a patient has experienced at least 2 unprovoked seizures. Okay? Please stop me if you don't understand something. Raise your hand. I want you to understand some terms. Aura. Aura is a warning sign immediately before, let's say, a patient loses consciousness. Actually, aura is nothing but initial part of the seizure. For example, all of a sudden I start smelling something. There is nothing in my environment, and all of a sudden I start smelling this rotten stuff, and then I lose consciousness. That odd smell is the aura, but it's telling me, actually, it's the initial part of the seizure, that the seizure focus is originating from that part of the brain which is concerned with the sense of smell. That's what it's telling me. If it's taste, then it's telling me that it's coming from that area of the brain where taste is represented in the brain. Okay? It just means the seizure itself. Okay? Post-ictal means it's a period immediately after the seizure. For example, this young lady mentioned he had a grand mal seizure. Afterwards, you feel sleepy, you may get a headache, you feel achy. Those are the post-ictal symptoms an individual can experience. Interictal means in between the seizures. Okay? Everyone understands those terms? Okay? Good. Epilepsy is universal. Every part of the world, and it goes back centuries. Okay? Roughly 1% of the population in the United States has epilepsy. Now, as far as one or more than one seizure at some stage in life, someone might have experienced. Approximately 9% of the population in this country will experience a seizure during their lifetime, sometime, at some stage in their lives. But that's not epilepsy. That's an individual seizure. Only 1% of the population, a little less than 1% of the population in the country has epilepsy. Who is prone to develop epilepsy? Being the age they actually develop epilepsy. If you see the bar graph here, it's at a very early age or after the age of 60. And there are different factors that play a part in the initiation of the epilepsy, and we'll come to that in the next slide. In between, there is a lesser chance of our developing, for example, you have a much lesser chance of developing epilepsy at your age. It's much higher once you reach old age, well, not old age. It's a late middle age, 60s, late middle age, 42. Okay. We divide, I'm going to come into seizures and epilepsies, classification. We divide seizures and epilepsies into two main groups. Idiopathic means there is no obvious cause, and there is also called primary epilepsy, and there is a strong genetic predisposition in this of epilepsies. Symptomatic, also called focal, that means there is a seizure focus in one part of the brain, either the right cerebral hemisphere or the the left cerebral hemisphere and results from some kind of injury to the brain. Doesn't mean trauma. It can be stroke, it can be infection, it can be some other injury to one area of the brain. And we mentioned the young, recently are developing, they may have a birth injury or before even, while the baby is still in the uterus. Okay? The baby in the uterus can have a stroke, or there may be placental insufficiency, or the mother may have had rubella during pregnancy, and the baby develops involvement of the brain from rubella, and that can lead to certain congenital abnormalities in the brain itself. Or there can be other malformations in the brain that can result in epilepsy. Metabolic defect, for example, soon after birth, number of babies develop either low sodium, low calcium, low glucose, and anytime they have those, they are prone to develop seizures, or trauma during birth, or infections of the central nervous system, meningitis, encephalitis, they can develop, or an abscess in the brain. Any of those, anytime there is injury to the brain and scarring, that can result in, become a seizure focus, and that can lead to recurrent seizures or epilepsy. In adults, the three commonest causes are stroke, head trauma, and tumors. Tumors can be benign or malignant. Okay? Any question thus far? Where everything is clear? Okay. I'm moving a little faster because with the last group, I didn't even finish my lecture fully. Okay, I want to go over these three aspects of epilepsy. Epileptogenesis. What is the mechanism of seizure generation and how does it spread when the seizure originates from a discrete area of the brain? And what is the mechanism of seizure generation in generalized idiopathic epilepsy where there is no obvious cause? Okay? What is epileptogenesis? Normally, the brain structure is normal. If each one of our brain is functioning very normally, if you were to do brain CT scan of the brain or MRI of the brain, everything will be normal. Let's say a person gets stroke or gets a gunshot wound to the head or is an auto accident and suffers a hemorrhage in the brain. Now, that particular, where the area where the stroke is, where the tumor is, or where the hemorrhage occurred, that can develop into an epileptic focus, but not right away. Usually there is a period of time, weeks, months, sometimes years, before the individual starts having seizures. So, how a normal brain cell neuronal network is an abnormal neuronal network resulting in seizures is called epileptogenesis. This transformation from a normal to an abnormal network is called the process of epileptogenesis. The precise cause is not known, but the hypothesis is, we all know that there are many neurotransmitters in the brain, right? Okay?